So I'm with Julia Brown, CEO of the Brandon Centre. Thank you so much for joining us today.
Great to be here with you. Yeah, good, thank you.
I know it's all a bit strange over Zoom, but we're really glad that you could come and answer some questions for us. Thank you so much. So my first one is, we'd love to know a little bit about the services at the Brandon Centre and what you provide, basically.
So we've been going for 52 years. It's a really special charity based in North London. We provide mental health services, we provide sexual health services, and we provide clinical training and consultancy specialists around adolescent young people. The charity started up by a doctor called Dr. Faith Spicer, who is a psychiatrist and a specialist in sexual health, and she trained at UCL Hospital. And it was amazing. She was very innovative in her time in order to be able to set this charity up. So that's the Brandon Centre.
Wow, that's great. Again, how come it was a sort of PatientSource that you chose, or why?
Oh, we did a lot of work. So some of the work had already started happening before I came to the charity, and I think that's where it got a little bit stuck of looking at big systems that were quite cost effective, were very expensive, and especially for a small charity, and weren't really flexible. So I asked around and got in contact with past contacts, and that's when I started hearing about PatientSource. So we invited PatientSource in to come and meet some of the team and to be able to explore about whether we could actually run that across all our services. Because of course, as I mentioned, we manage systemic services that's keeping young people out of youth offending and children's homes.
And it sounds like they are very extremely flexible. So for you, I guess that was really important, because you had such different various teams that you had to sort of deliver different things for.
So I think we had three, key areas. One around cost effectiveness and stuff. So we didn't have a lot of money, and I needed to find the money. I should have said that we actually were in financial challenge at the stage of when I turned up. So that was one key area. Then we needed the flexibility to be able to actually teach and help support staff to be able to use the record easily and in a different environment, whether you're a therapist working in a one-to-one environment or working across a system. And then we just needed to be able to report effectively, and each of the reporting systems into MHDS, so that's the mental health database, or the GumCAD and SHRAD, which was for sexual health, needed different reporting requirements. That first lockdown, we moved everybody out of the building apart from the sexual health team, so all the mental health staff went and worked virtually. It's incredible. We had a team that were not really used to delivering virtual services, let alone having a system that could actually deal with that. I don't think we would have been able to continue working as a charity over the lockdown period. I'm quite sure about that.
Wow, it's incredible that you sort of, managed to foresee something that potentially, it was much needed.
I remember at the time thinking it was something I really wanted to shout about, but it was not something that you'd want to shout about in the middle of the beginning of the lockdown, because obviously it was such a shocking time that we all knew quite a lot of people who were really struggling in hospital. I certainly knew quite a few people who passed away over that particular time in March, and it was just not a time. It was that dissonance between really feeling excited that we were surfing and moving forward and able to continue to deliver services to all our young people. If we had not got that system, I honestly do not believe that would have been able to, have happened.
Wow, well done. Also, I guess as sort of a small organisation, it's hard because you don't have specific project managers for each new initiative. So, sort of, how did PatientSource help you in a way to overcome that?
So I think that is one of the challenges. You're absolutely right, and I think buying and procuring new systems is always a challenge. I think the way that PatientSource worked is that we had a specific project manager, Damien Quinn, who was incredibly supportive, and so he got alongside staff, and he would come up and be with the teams and work in a very flexible way, very responsive. And I think PatientSource has continued to be responsive as we have moved forward. So actually we've just redesigned some of our sexual health teams. So we've got now a nurse-led service. So we've moved from medical-led model to a nursing-led model. And our new head of sexual health, David Ritchie, is in close contact on a weekly basis with Damien and Nick Genvy around the development of the system further. So I think it is very flexible, and that is what you need. We did not need a box-like system which would maybe be fine for primary care or fine for secondary care or community services. We needed something that was fit for purpose for Brandon Centre.
Yeah, that's incredible. Yeah, because I think I was talking to Nick about how it's the frontline staff can literally feed back to him sort of live, which is amazing. And how do your team members feel? Because obviously, as you said, there are sort of three separate teams. and how have they sort of got on with it with PatientSource?
I think they've all got on with it amazingly. If I mentioned that, you know, really none of us were, well, I was more used to working virtually probably in other walks of life, but nobody really was very used to working virtually on a clinical basis. And the mental health team, I have to absolutely celebrate. They have moved over from lockdown virtually. So they're all working over counselling and providing services over Zoom and Teams. It's amazing. And of course, that's supported by an electronic patient record system. So PatientSource has been absolutely crucial in all of that. I think that they just are very appreciative of the systems and of what we had put in place beforehand. I think the sustainability team are doing a mixture. They're working very virtually, so they're always out and about preventing young people, as I said, moving into youth offending and into children's homes. So we're keeping young people at home, and their systems also, being on the PatientSource system is really helping them to be flexible in their ways of working. And then sexual health, we're delivering face-to-face services when needed, but we do telephone calls at the moment during lockdown, and that's with all our young people, and again they're using PatientSource. And in fact, when we've had one incident the other day around some information governance areas, and PatientSource were incredible. I rang them up straight away to see whether we could actually embed a password into the system, and within 24 hours we got a solution. So it's been really positive experience.
That's amazing. And I think I read somewhere that some of the staff were a little bit worried at first and like not technically minded, but then I think Damien's been really helpful in sort of helping the day-to-day with them understanding it all.
Absolutely. I mean, I haven't had any queries at a senior level, which you'd normally have if there were issues with capturing data. And so it's been amazing. And I think I should say that with some of the mental health staff, we used to have a clinical psychology assistant employed full time in order to be able to count the data and collect the data from the old paper records and then input that into MHDS. And now that happens pretty well, you know, within a minute or something of the triangulation and shifting of the data. So, and the same for
It's sped up your time a lot.
Incredibly, yeah incredibly.
I think you've already answered this in a way, but what was sort of the feedback from the executive level? I guess they're pretty delighted with it all.
Yeah, I mean, I think at a senior level, at the heads of department level, I think it would be very hard to think how we could be working without a system like this now. And of course, I've got a few new people in teams. So David Ritchie was not here when we were on PatientSource. Pavlos and Michelle, who head up clinical training and mental health, they were, but I think they can really see the benefits of what we can do now versus where we were before. And then the board is absolutely delighted, I think, also about what we've got in place, and we're developing our internal and external reporting because of that.
Yeah. So a year on, how do you feel the journey's sort of been since the early days?
Well, I think standing back here now and sitting at home, but working virtually with you today, I can't quite imagine ever being able to survive on paper. It feels a much more smoother way of working. I think patients, young people, would be expecting us to be able to have systems that are safe and responsive. I certainly think for funders that we can demonstrate that we're working effectively and cost effectively, reporting in a timely way. And then at a board level, we'll be able to start seeing more internal information around performance and being able to do some deep dives. So certainly on our clinical quality, safety and risk committee, we've started looking into services more and seeing about what's working well and what's working less well. And without that key data to be able to triangulate the financial data, you can't really work effectively as an organisation without it.
I mean, I was really impressed to hear that Dr. Michael Brooks was writing a lot of the code himself. So I don't know what that means for you practically as a client.
I mean, I think practically it was a really big positive when we were looking at different systems, that actually there was a clinician heading up PatientSource who understood the need for data and safe recording of information. I mean, I think Mike comes from acute sector, so I think we've been able to shape the learning from a sexual health perspective and from a small charity, and actually be able to triangulate and be able to help develop systems going forward. So I think it's been really important, and certainly it's been very intuitive for staff to use.
And sort of frontline teams want to spend as much time delivering care rather than the admin. So has it been, what sort of the benefits have been around sort of time and motion benefits really?
I mean, I think they're significant. And as I mentioned, you know, we had a clinical psychologist in mental health who was doing, that was predominantly her whole job. And I don't think it was a very pleasant job sometimes, because she'd have to go into records, understand what other people had written, be able to transfer that onto an Excel spreadsheet, and then input the data into a MHDS database. And there were lots of errors that would obviously come up, and it would take a lot of time of cleaning that data. I think it was very accurate what was being recorded, but I think it took a long time, significant amount of time. So that's a whole post. And then certainly in sexual health, it was significant. You know, we're seeing over 2,000 young people a year at that current time, and all that data was being stored in paper records. So obviously, if there had been a fire or been a break-in, or if you can't find the records at that particular time, there was lack of, you know, joining up on some things, and then the integration between services. So it's been a remarkable saving of time in all ways, and improving quality and safety.
Right, thank you. So my sort of last question really is, what advice would you give to a service that's either still on paper or isn't, you know, the EPR that they have isn't really delivering what they want?
Well, I would say have a look around and see what is on the market. Definitely very happy to have conversations with anybody, so I can explain about what our experience has been and be able to show people. I think I would ask different organisations to see how they're working and how they're using the data, and what are the benefits of and what they actually need to address. So I think, yeah, I would definitely have a look at PatientSource as well. I do believe it's absolutely a flexible service that could be run across any acute sector, community or mental health. That would be the same for charity. And I know internationally there's a lot of great work that happens. I think it's particularly good for system-wide working.
Thank you, that's amazing. It's been absolutely inspirational to hear about your journey with PatientSource. So thank you, Julia. I really appreciate your time.